Thank you very much to Bruno, that I know from a lot of years, and it's a great pleasure for me to talk with you about adolescent and clinical aspect of adolescence. I want to try to speak English with you, and I'm not sure that is perfect, my English, absolutely, but I think that is an attempt that I can do with you. I want to speak. I want to speak with you about 50 or 20 minutes, and then it's possible for you to ask me a question about arguments that are not deeply touched from me, obviously. The argument, the object of our meeting is the clinical aspect of work with adolescents, and in particular, I want to share with you my experience in an organization of the third sector, that is an Italian expression that is my care to explain better to you, that is called Progetto Sum. I need to talk with you becoming from some ideas about how today we can think about adolescence, because we have a lot of knowledge about how adolescent is in general, in all times and places, but I think that is that we need to put in evidence some aspects that are specific of this age, because some of them are different from other ages. And I think that I want to put in evidence two aspects in particular, from a theoretical point of view, from an anthropological point of view, because I think that we need to think about the loss of absolutized references that are present in this age, and when I talk about it, I don't think that is absolutely a problem, but a characteristic of this age. The loss of certainty of religious, of political, of scientific point of view is for someone a loss. For someone is a problem of loss of references, of frame, but for someone is possible that is a freedom to search, a freedom to research a way. But the second aspect is about the push to individuality performance, that is, or the performance as an individual goal that is characterizing, in my way, this age, the problem of how I put my figure, my person in this environment, in this age, is my problem, is not exactly a general problem, but is a problem of each one. And these two themes are, for me, very important to rethink the organization of care, because we need to to think about the theory of the subject, of the man and woman, and of the human being, but also to how to think about the care. I think that is useful to think the theory of the human being, and in the adolescent in particular, as a subject, as a relational subject. And in this way, if we think about the subject as a relational subject, we need to think about how the environment that I have shortly described as an important factor in relationship to how the subject is. And in particular, I think that I can put in evidence only in a very short form some aspect that characterize today the idea of a subject, of the relational subject. And I think I want to put in evidence 5 characteristics. I only cite, only describe it, but after, if you want, we can deeply talk about them. One of it is, for me, the unity of the human being. The second is to be constituted of parts. The subject is unity and constituted of parts. The third is that is in relation with the environment and is constituted of the story of the relation with environment, with the begin and an end, and with a singularity of the trajectory of life inside of relationship. These are, for me, the principal words that describes the principal concept that describes how we think about a relational subject. From this point of view that characterize all the ages adolescent too, I think that we can think about the clinical practice and in particular the clinical theme, which ideas of how the clinical treatment can be thinking. And I think about the clinical theme with adolescent as a meeting of 2 systems. On one hand, the clinical system, and on the other hand, the system of the adolescent. The system of adolescent usually express this way of being in the relationship with the first. Is the second usually that put a question to the first, to the clinical system, but is the first that organize usually the boards where the second represent himself. The 2 systems has in its center the adolescent and the psychotherapist. And in a part of the clinical situation, this theme, constituted of 2 persons, is the only one. But in other situations, we have more complexity and a plurality of actors in both the parts. That is very usually in children and adolescent clinical practice, to have a complexity of the actors that are involved in the clinical practice that are more than 2. the goals of the clinical consultation is to arrive to an orientation about the future treatment and to give a taste of the clinical level of experience. I don't rest a lot of time on this theme, but I think that we can talk more later. If this is the framework that I have really very synthetically talking to you, is my care to describe how we are implemented in this project called Progetto SUM. SUM is a Latin word that is for sono in Italian, I am, and is the idea of the subject. This is centered in this definition. What is Progetto SUM? Progetto SUM is a lot of things. Is a cultural center of a training and teaching organization, and a consultancy. And I, in this meeting with you, I rest on this last part. And in this consultancy works some psychotherapists, psychologists, medical doctors, and there are a lot of other professionists of like nutritionists or gynecologists or family mediators and so on, that are in a sort of second circle around the first circle that is constituted of psychotherapists. One of the main aspects of Progetto SUM is the ethical aspect. That is the accessibility for all the patients and the sustainability for clinical system and for the patient system. The idea is that this project, the third sector, is in the sense that we are between public and private, between the state and the private practice. Is a third pathway that is in part with the ethical of the public services and in part with the boundaries, the limits of the private sector. Obviously, that is involved in the Italian culture and environment, and I don't know how is exactly understandable and exactly traducible in a other environment. I'm very curious about it, but I hear to you about something about that. But is more important, I think, for us to describe how the procedure of clinical meeting is used in this place, because it is a situation where we have a lot of actors that embodied the clinical system, and we have a lot of people that are asking to us and that are interested to have a care from us. Our procedure is based on the qualified listening of the question. From the first contact between the patient or his system with us is care of a psychotherapist that listen the phone or the mail, and then he or she brings have a colloquium with the asking person, and usually by phone, and he or she brings the question weekly to the team that organize the answer that believes better and possible, assigning it to one psychotherapist that is the director of the consultation. The idea is that we need to it's possible that we need to have a passage between who hear the question and who is involved in the consultation. But the idea is that the second is the professionist that is more competent on the about the team. I remember to you that it's possible that arrives to us a lot of kind of people, children, adolescents, adults, families with a lot of kind of problem. And it's important that who hear the question is able to understand and to have some basic information, but it's important that the second professionist is able to organize the trajectory of the consultation arrive to the goal, the two goals that I described before, the goal of orientation and the goal of taste the level of the relationship, of the psychotherapeutic relationship, because the consultation is a starting point for the treatment and is just a time where patient and therapist, patient system and therapist system are involved in a trajectory of where is there is a taste of how is possible to involve both. The therapist calls the client and begin the exploration using his specific theoretical frame of reference. That is important because all the professionists, all the psychotherapists of the group are not of the same frame of reference from a theoretical point of view. We are all from a psychodynamic and systemic point of view, but there are differences between us, and it's important that who is the reference of the case is responsible of the direction of the consultation. Is obviously possible to use the second circle of professionists, of other kinds of professionists, to better understand the problem, using to talk with a nutritionist or to a gynecologist or to someone else, expert of transcultural treatment and so on. And it's possible to use these professionists also sending them the patient if we have if we need to do. But the reference is the psychotherapist that is the director of the consultation. Obviously, this group, this meeting of Friday, this morning, we did this. This meeting of Friday for us is a place where, in the second time too, is possible to reput the exit or the trajectory of the consultation, and to involve other of the collaborator of the group if we discover in the time some aspect that need other deep of some particular aspect. The team meeting is the place of process in all the part of it, also after the first step. I want to go to the end of my short presentation, putting in evidence the particular position of our view of care with the subject and their systems. We treat the experience and the malaise too as a way of the subject and the adolescent too to be in his life in this moment better than he or she can do it. And the clinical system is a social actor that is emerged from the social environment, exercising a care function with him or her and the other social actors, a position that I consider horizontal and not vertical, as other social institutions and that are used to consider itself and are considered. The idea is that we are, as Progetto Sum, involved in a larger system of people, services, organizations that are is possible to involve in the process when is possible, when it is useful, and but is possible to in the more simple situation to have a therapeutic situation where the couple, therapist and patient are the only one and involved in a particular and specific treatment. This stream is for me very useful for adolescents, because the clinical adolescents need to have to have in mind the individuality of the adolescents, and this particularity is need to secret about some question, and on the other hand, they need to have in mind the framework, the network of the relationship where the adolescent is involved, that are in a lot of cases more than his family, but the school and football team or other. And our position of clinical in this horizontal way that I say is for me very coherent with this idea of the adolescent as a relational subject. I can if you want, I can stop here my presentation, because I think that the more utility of this meeting for me is to have a dialogue with you, and thank you very much.
Ok, obrigado, Fabio. Grazie, Fabio. You are receiving from the students. Well, I don't know if you have any questions. We will give some time for it. Vamos dar algum tempo aqui, emerjam algumas questões, está bem? Relativamente à apresentação do Fábio. Mas eu tenho uma ou outra. Well, stavo dicendo che possiamo prendere un po' di tempo perché emergono delle domande dalle studentesse del gruppo, dell'ascolto, della tua condivisione con noi, ma che io ho più che una domanda, una richiesta di se puoi approfondire un po' questa idea dell'adolescente, queste prime due caratteristiche che ci hai portato come due idee centrali che caratterizzano la situazione soggettiva dell'adolescente, che riguarda la perdita delle referenze e anche il soggetto performatico, diciamo così, la sto mettendo così. Adesso traduco per loro e dopo ti passo la parola. A minha pergunta, ou o meu pedido de poder aprofundar um pouco as ideias que estão por trás desta ideia do sujeito relacional e destas duas características do posicionamento desenvolvimental do adolescente como um sujeito que perdeu as suas referências e que isso abre a porta para uma procura com maior liberdade de outras referências, me parece um aspecto importante, e a ideia do adolescente como um sujeito performático, à procura de individualidade. Acho que são duas ideias muito interessantes que me parecem estar ligadas a esta ideia do sujeito relacional, mas que pedia ao Fábio se tinha a amabilidade de aprofundar um pouco. Allora,
thank you very much for your question. I think that are aspect for me very important for adolescents, but for all us, because the cultural environment where we are is a general question, is a general theme. The idea that is not mine, but is I use thinking of a lot of authors, very famous, in particular from sociologists that are studying this age. I think that it is important to put in evidence the idea that if we go to 50 or 60 years old, we have a society that is called modernist society, that is more rich of certainty, that are about different domain of the life. In particular, I think that the religious way or the centrality of the ideas of the future, of the ethical aspect that derived from the religious point of view are for a great part of society very important in the past, were very important, and are a sort of sacred part of the way of life that were not discussed, that are absolutely of course of our life. And this is not the situation of today. The situation of today is that there are a lot of references, a lot of perspective, a lot of ideas of how is we have to treat the life. That is, for me, for some authors, in consequence of what Edgar Morin called, we are in a unique village. Edgar Morin said that in our history, this is the age, is the second time that we are in the age of a unique village. And the first time was when the human being birthed about 200,000 of years ago, when we are in Africa, and where the human beings were in the same local village. Then we started from a long trip from all the planet. This moment is the second time, called Morin, where we are in a unique village. And is an epochal difference between now and a century ago. Obviously, this situation of a unique environment, a unique village, is gradually, but the discover of the last part of the last century and the first part of this, in particular with the internet and so on, is an important step in this direction, an acceleration of this process, very intensive. In this sense, if a century ago we can say that what happens in a land of the earth is not my problem, now we can't say it, and we are involved or in teams that are very far from us. The war actually is an example of this. The virus of COVID is another. In this sense, the loss of references is from a religious point of view, from a political point of view, because we have lost the ideas that one ideology is able to resolve all the problem of the people, and the idea that what we do actually is a first step of the future that is a paradise future. We now suffer, but for a future that is better, where these equality are resolved, where malaise are resolved, where it's possible to have a sort of a perfect place. This idea is absolutely broken and is absolutely not in the mind of people. And this is connected to the idea that also the scientific idea, the idea of science is collapsed. Because yes, the science is very useful, but the science is the actor of disaster too, of the atomic bomb, or how we treat the planet. And this idea is not an idealized idea of science that how was some decades ago. The science too is in evidence today that is an instrument to understand, but is not the solution of all our worlds. There was a phrase of people that called to Elon Musk some years ago, saved from death. Can you save us from death? The idea is that science is not in the condition to save us from death. And this situation is that in the complex, that the certainty of our culture, in particular in Occident of the world, because in other part of the planet we have culture that are today more rich of certainty, but in the Occident of the world we have these diffused ideas that we are not certainty. We are involved in a situation of uncertainty. I don't know if it's correct. And this is one aspect. The second aspect is the push on the individuality. Because the idea, I think, that is in the Occident of the world, that in this landscape, you are the responsible of how to put in, how to have to be, to use your body, to use your knowledge, to put in a place that is not necessarily where you birth, how to, if are male or female, you can choose. You can use the knowledge that are in the web, but you are the author of your life, and this is very interesting, stimulating point of view, but is a very difficult and sustainable point of view. In particular, why these aspects are important in adolescent? Because in adolescent we have a phase of an age where I'm called to put in the field this perspective. In infancy, I'm more inside my family, my culture of where I become, but in adolescent, I'm pushed to use this perspective to start with the construction of my life. And this is a very difficult task, a very interesting, but very difficult. And I think that adolescents are very able to share this situation. And this is one of the reasons for the importance of the group in adolescence, because the idea that I can share this perspective with my colleagues of age, my classmates, and so on, is one of the things that adolescents are able to do to coping this task.
Grazie Fabio. Well, algumas questões? Tenho para colocar?
Hi. First of all, thank you to share your knowledge with us. And I have a question. I don't know if it makes sense, but my question is about this autonomic everything in the adolescence period, but how as like future psychologists, developmental psychologists, how we can what we can give to change this let's say that this what I think it's the society is a little bit difficult to the adolescents be autonomous or independent or work with this what you said, because
I don't hear very well. Can you translate?
I will try to translate.
Okay.
Well,
Because
she was asking that if I understood well, something related to this. How can we as psychologists or as developmental psychologists deal with the difficulty of adolescents in with this conception that you were presenting, deal with the problem of becoming an autonomous individual. How can we, since I believe this is related with the things you were saying of individuality, but how can we help in this period of life, like adolescents, help them deal with the challenges of autonomy?
Yeah.
The society don't give this opportunity for the adolescents to be autonomous and or respect their individuality.
Okay. Because she was saying that she thinks that there's less support and opportunities coming from the family system and also from the society for them feel support in acquire economic autonomy, emotional, subjective autonomy.
Yeah. Thank you. Very interesting. I think that there are a lot of things. The first is that in the past, and is useful for me to put in evidence the difference between the actual situation and the past, because in the past we could have as an adult, as a clinical professionist, a position more strong, more certain about models of development, about the ideas of future, and in a position more vertical in relationship with adolescents. I think that a character of this situation is, for me, that we are in the same boat, and that is not. I don't say that we are the same of the adolescent. We are characteristic different from experience and professional point of view, but I think that the clinical perspective in the treatment of adolescent is to be in a sort of being between in a trajectory that we share with the consciousness that we are in the same world, in the same cultural situation, where I can put in the relationship with him or her and his family the instrument of interpretation, comprehension of this situation, but not with the solution of the problem. That is a different perspective from the past. I think that I don't want that my description was a sort of catastrophic description, because it's not my idea. I think that this is more an adult perspective, this catastrophic point of view. The loss of references we can describe as a catastrophe, but we can describe it, and I think that for young people is more present this perspective, as an opportunity to rethink how we can do, how we can think about the future, know that the ideas that we have usually hear from the adult are not necessarily useful, and the task of the new generation is in general to rethink creatively how to think about the future. This is not a depressive point of view for me, but is an exciting point of view. It's a very interesting point of view, but it's not easy to go ahead. And the position of the clinic is for me inside this framework. I'm with you and with your family to put my competence, my ideas, my interpretation of the situation for your responsibility to be in the world.
I don't know if I can address also with some thoughts this question, but I think if I have understood well, it seems that the clinical position, the technical, methodological position, is not based on giving responses of security, but is based on the recognition that also the clinical has no certain answers to give, but is able, and what he can give is his ability to think on the situation, emotionally and effective. And that probably the suffering that the adolescents are expressing is not because they have less solutions or secure solutions, but it's because they are missing an environment able to think on their individual condition. And this is what the clinical intervention must be able to bring, without saturating with a lot of answers and certainties, and giving space to what seems to me the most important developmental task of this period, that it is the subjective appropriation by the individual of his own, what he is, and how can he relate to his environment.
Absolutely.
And in this sense, I believe that maybe trying to understand what truly, from a psychological point of view, should we understand the developmental idea of a concept like autonomy. Autonomy may be described by a lot of external dimensions, but from the psychological point of view, I think it is better described by the ability to be your own and think of you as a global entire person, with aspects that are difficult to live and aspects that are not so difficult to live. But the job of a therapeutic intervention is to help the adolescent to deal with the all dimensions, and not only the satisfying dimensions of their performatic tentatives to be someone.
Yeah. Absolutely. I can say that for me, the ideas of the idea of presence to myself is important. My goal of the therapeutic treatment is not to change the behavior or the emotions, but is to be more in contact with how I am, how I specifically hear my body, my mind, my ideas, my emotions, and from my point of view, there is not a problem of autonomy because this subject is autonomy from the starting point of his existence. And it's not possible that is not autonomy. And in this sense, is important more how he or she here is in contact, is able to consider and to treat his way of being. That is in this basket we have a lot of things. Our experience of me are constituted by a lot of things, emotions and bodily sensation and so on, that characterized my singularity.
Mm-hmm. Mm-hmm.
And I think that
the fifth characteristic of a relational subject.
Yeah.
The singularity.
Yeah. That is it was very short in my presentation, but the idea is that there is not a normality. There is a singularity of the trajectory. All the trajectory of life are with dignity for a person, and when a clinical talk with the patient, we are in front of this singular trajectory, and is exactly our point of view when we work with.
Wow. Thank you, Fabio. I think we are in time.
Okay.
For our talk. I would like to thank you. Grazie mille per la tua disponibilità.
Grazie a voi, veramente grazie. I hope that is useful for you and for your students, my contribution.
I think it was. I truly believe it. And in the next moments after finishing our meeting, we will talk about it. Continue. Thank you. Thank you, Fabio.
Thank you to you. Bye.
Bye. Thank you.